Hi, everyone. Welcome. Oh, wow. So many people are joining already. Nice to see everyone. Happy St. Patrick's Day. I forgot that was today. So if you're celebrating, have a happy St. Patrick's Day. We're going to kick things off in just a few minutes. We're just going to give folks a chance to join and settle in. We have so many people registered for this event, which is really cool. And we have really great questions that have already come in from the community that we're excited to answer. Hi, Shawnee. If you want to share where you're joining from, say hello, you can do so in the chat on the right-hand side. We have Joey joining from Denver. Kansas City, Michigan, Dallas. Oh my gosh. Every time we have one of these, I feel like we are representing all 50 states, but I could be wrong. Amazing. So I think we can go ahead and kick things off, and people will just start trickling in if they're a little late. So for anyone who doesn't know me, I am Nicole. I am Good Dogs Breeder Community Lead. Thank you all so much for joining us today. We are super excited about this webinar. It is with Dr. Raj Naik, a veterinary nutritionist at Purina, which is so exciting. And like I said, this is a topic I think that our community has really asked for. So we're super excited to have him with us today. And again, we have had a bunch of questions come in already, so we're going to do our best to answer them. But if you have anything else, feel free to drop them into the chat, any comments and questions, and we will do our very best to get to them. And for anyone that's new here, really welcome. For anyone that's new to Good Dog, we are on a mission to build a better world for our dogs and the people who love them by advocating for dog breeders, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community that is built for breeders, completely free for breeders, and really empowers breeders with technology to level up their breeding programs. We offer tools like a secure payment system to protect you from scams. We have best-in-class software to help you post and manage your litters, really anything and everything to make your program as successful as it can be and as easy to run as it can be. So if you are not yet a member of our community, we would absolutely love to have you, and we invite you to learn more about our mission and apply at gooddog.com/join. And with all of that being said, I will pass things off to Dr. Delgado, who is part of our health standards and research team at Good Dog, to take it away from here.
Thank you, Nicole. I am super excited to introduce Dr. Naik today. We know nutrition is something you want more info about, and I will be introducing Dr. Naik, and then I'll be back to moderate the Q&A at the end. And just to let you know, we're going to do our best to answer as many questions as we can. We may modify your question to make it more general so that more people can benefit from Dr. Naik's answer, but we will do what we can. So without further ado, Dr. Raj Naik developed a special interest in clinical nutrition while he was at the Virginia Maryland College of Veterinary Medicine. After graduation, he completed a rotating internship at a large specialty hospital in New Jersey. Thereafter, his love of nutrition brought him to the University of Tennessee to pursue specialty training in small animal clinical nutrition. Dr. Naik's trust in Nestle Purina's innovative research and formulations led him to join the company shortly after he completed his residency. As the veterinary communications manager and one of several board-certified veterinary nutritionists at Purina, Dr. Naik serves as a liaison between Purina and the veterinary community. Dr. Naik serves on the membership committee for the American College of Veterinary Internal Medicine. So please join me in welcoming Dr. Naik.
Thank you so much for having me. I really appreciate the opportunity to chat with all of you. I really want to thank Good Dog for the opportunity, as well as the Purina Pro Club brand for kind of tapping me to help give this lecture. I think there's a lot of really great nutrition content in here that not only breeders can benefit from, but veterinarians as well. This is a topic that we touch on in vet school, but there's always more to be learned. And so again, thank you to all of you for joining me. I'm joining you from Ann Arbor, Michigan, where it is miraculously beautiful outside right now, despite our basketball team at last checked being drudged by Colorado State. We will move on from there. So before we jump into specifics about reproductive and pediatric nutrition, I want to touch on a few general nutrition concepts to help with our discussion. There's 6 basic nutrient categories. So fats, carbs, proteins, water, which is one that we forget about often, are all considered macronutrients. So they're present in the diet in large amounts. And then there's 2 that are considered micronutrients, so present in the diet in small amounts. Cats, vitamins and minerals, and cats and dogs, as well as humans, need an appropriate amount and balance is key, of those nutrients from those 6 basic categories. So fats, carbs, protein provide energy. Vitamins, minerals, water don't provide any calories, but they are essential to life. So I want to touch on a few of the most important macronutrients for specifically reproduction and growth. Water, like I said, is kind of often overlooked as a nutrient, but we all know that it is the most important nutrient. It's vital to life. It's the most important nutrient that both we and our pets take in. It regulates and maintains body temperature. It aids in digestion and absorption of food. It transports nutrients throughout the body. It removes waste from the body. And so it's important, it's really imperative to provide access to fresh, clean water for all animals at all life stages at all times. 70% of that pug that you see on your screen is water. And so we have a clear indication for providing this water, clean water at all times. Protein, of course, absolutely vital to the whole reproductive process. So gestation, lactation, growth, fetal growth, it's incredibly important to have that protein available for organ development. Neonatal growth, of course, the musculoskeletal system is very dependent on that protein intake. And then things for the mom, so mammary tissue development and milk production, protein is vital to those processes as well. Protein, if you remember back to kind of your middle to high school science classes, protein is essentially this chain of amino acids. So these smaller molecules that form a chain, and then they form together to make this protein. Protein quality is dependent on what those amino acids are. So it turns out dogs and cats and humans don't actually have a protein requirement. They have a requirement for these essential amino acids that you see on your screen. They have to get them in the diet. So that's what I mean by essential. A high quality protein has a lot of or all of these essential amino acids. It is bioavailable, meaning it has good digestibility, and those amino acids in the diet can actually be absorbed by the animal. And of course, there is a species-specific amino acid requirement. The ones that you see on your screen are typical of cats and dogs. Most protein sources that you can think of are what we would call incomplete. So meaning they completely lack or they don't provide enough of at least one essential amino acid. And so in order to fill that gap, we can combine 2 or more protein sources to complete that essential amino acid puzzle that you see on your screen. So remember, I need to get all of those essential amino acids in my diet. So let's take a look at an example of how we do that with pet food. You see all the way on the left, an ingredient called chicken meal. And chicken meal is very rich in lysine and methionine, 2 of those amino acids that I was talking about. But unfortunately, it's pretty low in leucine and tryptophan. So 2 more of those essential amino acids. So how do I balance that out? Well, I'm going to use corn gluten meal. I'm going to use some soybean meal to help fill in those low levels of leucine and tryptophan. And by combining it with chicken meal, I also fill in the gaps that corn and soy may have in its nutrient profile or its amino acid profile. So you can see how these kind of fit together to make that what we call a complete protein. Omega-3 and omega-6 fatty acids, there's a lot of talk about these. Fatty acids are essentially produced when fats are broken down, and they can be classified by chemical structure. We won't go too much into chemical structure, don't worry. But two of those important fatty acid classes are omega-3 and omega-6. And you see on your screen some of the functions of those omega-3 fatty acids, such as supporting brain and vision development in puppies and kittens, managing inflammation, not just in puppies and kittens, but certainly in the mom and the dad, and then supporting those healthy joints. And the main source of that is going to be oily fish. So you'll notice that in our Purina diets, the source of EPA and DHA, omega-3 fatty acids, is fish oil because it is a very dense source of those omega-3 fatty acids that we're really looking for. DHA is, we're going to talk quite a bit about DHA because it is really optimal for brain and retinal development in these puppies. Omega-6 fatty acids get a bad rap, I will say. So they are thought to be associated with a pro-inflammatory condition. That's not necessarily really the case. So it's important that we have the ability to ramp up our immune system and to have that inflammation available to fight off infections. And omega-6 fatty acids, certain omega-6 fatty acids are required in the diet to help support skin and coat health. And so kind of venturing away from what we're going to talk about today, but if you had a patient that had a dog that had a kind of a lackluster coat, or they have some certain dermatologic issues, we'll prescribe omega-3 fatty acids, but we're also going to prescribe omega-6 fatty acids because it helps support that healthy skin and coat health. You see a couple of other things on the screen that it helps with. These are generally, they can be vegetable oils, but they're also found in higher amounts in animal fats as well. Carbohydrates. This is something, actually in humans and in most mammals, there is no direct requirement for carbohydrates, which is a little, might be a little jarring to folks, but there is no actual requirement except in the particular case that we are talking about. So in gestation and lactation, there is thought to be some requirement for carbohydrates because it is needed for fetal development. And then of course that lactose synthesis that we're getting from in mom's milk. Glucose directly impacts mothering. What do I mean by that? So hypoglycemic females with low blood sugar often are lethargic. They don't encourage their puppies to nurse. And so we're not getting to give these puppies what they need if their mom is unable to have the energy that she needs. And finally, we have this really beneficial effect of carbohydrates in that they have what I call a protein sparing effect. So when we have really digestible carbohydrate sources present in the diet, protein doesn't have to be used for energy. And that's really, really important. Protein can only do one thing at a time. You want to save it for building the tissue in that puppy or in that mom, rather than burning it for calories. This, beta carotene, I put in sort of as an example to say that every nutrient is really important. So, we don't talk a lot about vitamin A when we're talking about how many calories this patient should get. Protein is really important, et cetera. Every single nutrient is important for all of the reasons that you see on your screen. So in patients that are gestating, it promotes estrogen synthesis. It helps with development of the endometrium. It prepares the uterus for implantation of embryos. Lots of different functions for vitamin A, specifically this version called beta carotene, in these moms. I get this question a lot about whether I can, we don't eat complete and balanced diets. unless you are very, very diligent about what you're eating, we typically do not eat complete and balanced diets. And we think, well, I'm fine. I can just eat a complete, I can eat what I want. I feel okay. There isn't anything clinically wrong with me. But oftentimes what we find is that there are very few people that actually eat a balanced diet, and often those people have some sort of subclinical disease. So there is something brewing that we don't have an overt clinical sign for, an overt symptom for, but because there is a nutrient deficiency, there is something going on. And I will give you an example here. Vitamin A is one of those things where I don't necessarily have to give it every day to a dog. It stays in the liver for 6 months. It's pretty resilient. You're not going to burn through that vitamin A store very quickly. However, at the bottom of your screen, you see arginine. Arginine is an essential amino acid, especially for cats. So if I were to give a cat a complete and almost balanced diet, or excuse me, an almost complete diet, and just left out arginine, within about 3 hours, that cat may start having neurologic signs and potentially can die. And the reason for that is arginine is an essential part of a function in our body that gets rid of waste. And without arginine, I can't get rid of waste in that cat. And of course, those toxins build up in the cat. The toxins go to the brain. We see those neurologic signs. And so when somebody says, well, can I just, can I feed my dog what I am eating? Or can I feed my cat what I'm eating? I like to think of dog food as a baby formula. So I don't have to, if I'm feeding a complete and balanced dog food, I don't have to worry about supplementing anything else. I don't have to worry about rotating between foods. I want to make sure my dog is getting everything that he or she needs. And so I am going to be feeding a complete and balanced diet in the form of a kibble. How do you pick that food? So this is an incredibly important question that, again, I get all the time, not just from breeders, but from veterinarians and from clients. This is a list of questions that's popping up on your screen that are really good questions to ask a pet food company. So do you employ a full-time nutritionist? Who formulates your diets? Is it someone like myself that is a board-certified veterinary nutritionist? Is it a PhD nutritionist who knows a lot about food science? Have your foods gone through feeding trials? Where are they produced and manufactured? All great questions. Some of these, there are answers that I would like to hear from a pet food company. That doesn't necessarily mean there's a right or wrong answer to some of these, but what I'm really looking for is that the company is willing to answer them. So a lot of companies will just ghost you, or they will not get back to you. They will not fully answer your question. And so I like to stick to these 8 and see what they have to say. This list of 8 questions came from a resource on the World Small Animal Veterinary Association Global Nutrition Committee website. This is a group dedicated to disseminating nutrition information as well as other animal health information, but they've put together this great list of resources to help you kind of make that decision. This is one of the resources they have. They also have a document called the Savvy Pet Owner's Guide to the Internet. And so they help you kind of wade through potential misinformation or where to find the good information. So I was working on this presentation this morning, and I tried to make a bunch of QR codes for different websites. My browser kept crashing, so unfortunately, there's no QR code on here, but I spoke with Good Dog earlier, and we can actually put the websites to a lot of these resources in a document to send out to you folks. So we will have these resources available to you. One other one I want to mention is the Pet Nutrition Alliance. The Pet Nutrition Alliance is a number of veterinary nutritionists, folks that are interested in veterinary nutrition and getting the right information out to all of you. This is a screenshot from their Dare to Ask tool. And essentially, they took 3 or 4 of the questions that I just showed you, and they called a ton of different companies. And those companies either answered or they didn't. And that all of that information is listed, so you can look at whatever company you may be evaluating for, you know, do they meet the questions that I mentioned earlier? A lot of those questions have been asked of them already. All right, you will notice that there was no question on that previous slide about specific ingredients used in pet food. So we often kind of interchange the word nutrients and ingredients, even though they're very different things. Ingredients are those raw materials used in pet foods to provide nutrients, What matters most is that we use high quality ingredients so that they can provide the nutrients that the pet needs. And when I say high quality, I mean that the ingredients are digestible and those nutrients are available for absorption. I mentioned this a little bit earlier. So things like chicken, beef, rice, corn, they're used in different combinations to make dog and cat food for specific purposes like growth, maintenance, performance, or to address certain health conditions. And a lot of what I do is I am helping to evaluate patients and help veterinarians address those certain health conditions. We also deal a lot with healthy pets, and that's what we're talking about today. My takeaway from this slide for you, it's important to focus on those nutrients provided by the ingredients in a particular pet food, not on just the ingredients themselves. Again, do ingredients matter? How do we pick them? So how does a company like Purina, like one of the other larger manufacturers or smaller manufacturers, pick the ingredients that are in pet foods? So first of all, we look at nutrient content. That should be the primary driver. Is this food going to provide what this dog needs? Second, palatability. Of course, we can make the greatest diet in the world. We can make it complete and balanced, but if that dog or cat is not going to eat it, what's the point? And then, of course, digestibility, we touched on before. Are the nutrients in there bioavailable? And then, of course, consumer preference. And so you do tend to see these days a trend. The human diet trends kind of translate over to the canine world. For the most part, that's not, we can formulate diets to kind of meet the nutrient requirements of the dog. Sometimes it gets a little sticky because we are not the same species. And especially when it comes to cats. I know we're talking about mostly dogs here today, but cats have very unique nutrient requirements. And so making sure that we're getting everything that the pet needs in that food is of primary importance. All right, the AFCO nutritional adequacy statement. AFCO is it's not a regulatory body, but it is a body that makes recommendations to states and to the federal government as to what should be in a pet food. And they require a nutritional adequacy statement on every pet food label. It's probably the most important thing on the label itself. And sometimes it's a little bit buried, so take a look. It is going to say something to the effect of, and this is the nutritional adequacy statement from the diet that you see on your screen, so the Purina Pro Plan Performance 3020. The statement says, animal feeding tests using AFCO procedures substantiate that Pro Plan Performance 3020 chicken and rice formula provides complete and balanced nutrition for all life stages, including growth of large-sized dogs, meaning 70 pounds or more as an adult. So that's a long statement, but it told me 3 very important things. One is that this diet was tested using animal feeding tests. And we'll talk about what an animal feeding test is in just on the next slide. But it means this diet was actually fed to dogs, and they were monitored for their health, and these dogs all turned out healthy, and this diet has actually been fed, as opposed to a diet that is formulated. So meaning a company makes a diet based on those AFCO minimums that AFCO has recommended, and we say, okay, this should, in theory, provide adequate nutrition for this pet. The two other pieces of information that statement told me was that it is complete and balanced for all life stages, as opposed to just for adult maintenance pets. So, your standard 5-year-old German Shorthair Pointer that happens to be on this bag, that is not breeding, that is not growing, that diet is okay for that maintenance of adult dogs. You may also occasionally see a growth claim on there. So you can feed this diet to a dog that is a puppy, a growing puppy. And now you have to delineate between a typical size growing puppy and a large breed puppy. And then, of course, this is kind of rare to see, but some diets formulated for gestation or lactation. All life stages diets are appropriate for all of those different stages. ProPlan Performance 30/20 is appropriate for all of those stages, and that's why it says complete and balanced nutrition for all life stages. And then the last thing it told me is that this is appropriate for growth of large size dogs. That is a new thing, I think, as of 2017. If a pet food does not have that statement, including growth of large size dogs, 70 pounds or more, then you should not be feeding that diet to a growing puppy that is more than 70 pounds. We'll get into the differences between the diets on the market, but that is an important caveat these days. I mentioned animal feeding tests. So an adult maintenance trial has to go on for at least 6 months. Some larger manufacturers will be able to continue this on for longer. These are very expensive trials, very, very expensive trials. And so a lot of the larger manufacturers have the resources to do this kind of feeding test. You tend to see the label that says, animal feeding tests using AFCO procedures on foods that are from larger companies. Smaller companies, they don't have quite necessarily the same resources that others do. You may see more often this diet is formulated to meat. Growth trials are done in puppies and kittens as well for a specific period of time, about 8 to 9 weeks. Gestation and lactation studies are done throughout the pregnancy, as well as after the puppies are born. And then those all life stage diets, they have to run the whole gamut. So they have to be fed for maintenance, for growth, and gestation and lactation. And so those trials tend to be quite long. All right, with those concepts in mind, let's turn to canine reproductive nutrition. It is absolutely vital that the sire and dam are at peak body condition at the day of conception. So we have studies to show that puppies born to malnourished dogs have reduced birth weights, are prone to hypoglycemia, and have poor survival rates. There's also reason to believe that malnourished dams will have lower conception rates, and those dams that are obese prior to breeding have lower ovulation rates, smaller litter sizes, and perform poorly during lactation. The graphic that you see on your screen, that is an ideal body condition dog. Our goal is to keep them as close to ideal body condition as possible throughout pregnancy. So when do we need to start changing those the caloric intake for those breeding females? I show you this slide mostly to demonstrate how the energy needs of a female really don't change until the 3rd trimester of pregnancy. So at that time, you can start seeing the fetus grows at a very rapid pace. That requires a ton of energy, and we have to really pay attention to mom's nutrition at that point. There's very little change until about week 6 of gestation in terms of energy needs of these breeding females. You're going to see a body weight increase of about 15 to 25% during gestation. Less than that, more than that, adjustments need to be made in the amount of food that is being offered to the mom. And then we also have a focus on these puppies. So these puppies gain about 75% of their birth weight during the last 3 weeks. So that's why we're really ramping up the amount of food we're offering in that 3rd trimester. So those last 3 weeks of pregnancy, we're going to increase the amount of food that mom is getting by about 1.5 times what she would have normally gotten to maintain an ideal body condition. So ideally, this dog on your screen would be in an ideal body condition when she got pregnant. She's eating 1 times the amount of adult maintenance food. And we're going to increase that to about 1.5 times what she was eating before. In lactation, you're going to increase it quite a bit. So up to 3 times what she was previously eating as a just walking around adult maintenance diet. Of course, optimal nutrition is very important in this during this period. Optimal means not over or under nutrition. Okay. So both overnutrition and undernutrition can be problematic. For this pregnant dog, we want a diet that is highly digestible. So I'm talking about above 85% of the diet is digestible. We want a diet that is nutrient dense, energy dense, because we want to reduce the amount of stomach fill that this patient is experiencing. There's a lot of puppies in there. We have a smaller stomach capacity. Let's feed an energy and nutrient dense diet. And then finally, I talked a lot about quality. So we want a high quality diet that has these bioavailable nutrients. I'm going to pause here for just a second because I know you'll probably want to take notes on this slide. From the 1st week to the 5th week, don't increase the food. Every week after that, increase the amount of food that your dog is getting by about 10% up through week 9. So we're increasing again up to about 1.5 times what your dog is currently getting. Important here not to over or underfeed again. All right, so summary for a pregnant dog. Increased food intake is necessarily only after that 5th or 6th week of pregnancy. That pregnant dog should be fed a puppy growth diet or an all life stages diet to cover those increased energy and nutrient requirements for herself and for the fetuses. Splitting the daily food into several meals during the day is helpful since that GI tract has limited space that we talked about. And then milk production usually starts just a few days prior to parturition, but it could be delayed, especially in first-time mothers. So don't panic there. All right, lactation. So you see on your screen we talked about these 6 nutrient categories at the top of the talk. The milk composition reflects whatever mom is eating. So it's important to provide a complete and balanced diet to mom. This is where you're going to see that enormous increase in appetite. Mom is eating in that first week to 2 weeks after she gives birth, 2 times what she was previously eating as a non-pregnant dog. In weeks 3 to 4, she's going to eat triple and potentially more. Depends on the metabolism of that dog. You're going to start decreasing at about 5 to 6 weeks. And so again, we're sticking with a highly digestible, high quality, energy dense diet. Lactation, I know, actually I'm going to jump just ahead for just a minute. Nutritional needs of lactation by weeks 3 and 4, maximum nutrition needs are achieved. So the number of nursing offspring actually directly influences the nutritional needs of mom. The more puppies you have, the more food mom is going to need. And moms are amazing. The lactation needs take priority over the needs of the mother. So what that essentially means is mom's going to sacrifice whatever energy stores that she has to feed those puppies. And so it's important to try to restore that energy through the proper nutrition that we've been talking about, so that she doesn't start losing a lot of body mass, a lot of lean muscle mass as she is feeding these pups. Some is normal. That is the idea, but you don't want to lose too much. We are again looking for a highly digestible, energy and nutrient dense diet. I would say just feed the same diet that you were feeding during gestation as long as mom is doing well. This is not the time to be experimenting with new diets while mom is going through a lot of change. Providing adequate calories to prevent excess weight loss. Again, I mentioned there's going to be some weight loss, but we don't want it to be excessive. And the best way to assess that is to do body condition scoring that we talked about a little bit earlier. Weighing a patient is a little bit insensitive because where are you losing the weight from? You really want to look at the overall body condition score of your dog to make sure that they're not losing excessive amount of weight and excessive amount of muscle mass. This is really important. So feeding multiple times during the day, during peak lactation, helps keep that milk supply up. It helps mom to get really energy dense meals in a small package. Oftentimes we recommend separating mom from the puppies to eat just so she has a break, honestly, so she can actually focus on eating. We're going to start weaning those puppies at about week 4. Okay, and so the only way to really do that is to start scaling back the amount of food that we're offering mom so that she's producing less milk. And of course, if any of you are parents, you know how thirsty lactating moms get. And so this is incredibly important to have fresh water at all times. For specific periods, we're gonna breeze through some of this because I want to get to the nutrition part of it, but there's 4 very important parts of puppy development. That newborn puppy has a really, really high rate of growth. So that birth weight can double during the first 10 days of life. They don't have a shivering reflex, so they're relying on mom as the primary heat source. And they're gonna spend most of the day sleeping and eating. They should be nursing 4 to 6 times a day. First few days, 24 to 72 hours, I would say, are nutritionally very critical. The puppies are getting all of their nutrition needs from their mother's milk. So those newborn puppies need about 25 calories per 100 grams of body weight. I'll say that again. So 25 calories per 100 grams of body weight. I mentioned, I think previously, that first milk is known as colostrum. Compared to regular milk, mature milk, colostrum has a lower amount of fat and protein. It still has all of the energy, protein, fat requirements, and those essential vitamins and minerals. What's special about colostrum is that it contains antibodies and those immune and bioactive substances, which are absorbed through the intestine during those first couple of days of life, really the first few hours. And it helps provide immunity from diseases that mom has been exposed to or mom has been immunized against. And so it's incredibly important, if we can, to get these pups to get some of that colostrum in those first 72 hours. In the first 2 to 4 weeks, puppies are becoming much more alert. They don't require mom to stimulate them to urinate or defecate. They're learning a ton. They start to be more interactive with things in their environment, and then their teeth start appearing at about 3 weeks of age. So a huge developmental change here. Milk alone is going to be adequate to support normal growth until just about 4 weeks of age. After that, we will not be able to provide enough calories for these puppies just through milk alone. And so at that 3 to 4 week stage, I would start introducing a semi-solid food. So what I mean by that is like a gruel of kibble made with 1 part of growth diet and then 2 parts of warm water. So 1 to 2 parts. And that's going to get puppies a little bit more used to what kibble tastes like, as well as decrease the risk that they choke on a piece of kibble. So that gruel is really important. Semi-solid at 3 to 4 weeks. This weaning puppy stage, so weeks 4 to 8 of life, is a critical phase. They're losing mom as a temperature regulator. They are exploring the environment. They're exposing themselves to new pathogens. They're changing to a new food, and they're developing their immune system. And so supporting these pups during this period is very critical. I'm sorry, that's cut off a little bit, but I mentioned that we will not be able to provide enough calories for these pets at this stage just from milk. Mom actually also loses interest in nursing. And so this is a stage when it's imperative that you start introducing that gruel. By the 5th week, they should be really just eating solid food. And by 6 weeks, they should be able to chew that dry food. So up until about 6 weeks, we can continue to give them that gruel. We can lower the amount of water we're mixing in just to get them a little bit more used to a thicker gruel. And then we have them eating dry food by 6 weeks. Behavioral weaning is a little bit different. So nutritionally, they're totally on kibble by 6 weeks of age. Behaviorally, they're still going to want to nurse from mom up until about 8 weeks of age. So it takes a little bit longer. And that's why we recommend leaving puppy with mom until about 8 weeks of age, at least. Growing puppies are adorable. First 6 months of life, there's huge, rapid growth and development. Most dogs are going to increase their birth weight 40 to 50-fold. And this is a really interesting chart that I want to show you. So you see, let me see if I can get my laser pointer going. You see on the bottom part of your screen, the growth chart for a number of small breed dogs. And you have your kind of medium to large breed dogs. And then you have your Great Danes, so your giant breed dogs. These giant and large breed dogs have a higher growth rate than these smaller breeds. That does not mean, I want to emphasize this part, that does not mean that you need to provide more calories in relation to what a smaller breed would get based on body size. Okay, so just because they are growing faster does not mean that we need to make them grow faster through the nutrition we're giving them. It's actually the opposite. So they're going to get to whatever size they're going to grow to, regardless of how quickly they grow. If we grow them too quickly, there can be a lot of things like skeletal issues and growth development problems. The age, and we'll talk about that in just a minute. The age of skeletal maturity for these dogs, these smaller breeds, they might be skeletally mature by 9 to 12 months. And that's when I would recommend switching from a puppy food to an adult food. These medium to large breed dogs, anywhere from a year to a year and a half in age, is where I would transition to an adult food. Great Danes, 2 years, 2 to 2.5 years, honestly. So it takes a long time to get these pups off puppy food, but for good reason. I highly recommend not switching any earlier than those dates that I recommended there. There's an immunity gap at this stage. So the puppies have not fully developed their own immune systems. They may get sick more often. This lasts until about 5 months of age. And so this is, again, a critical period where we need to provide adequate nutrition for them. These growing puppies have a higher energy requirement, higher protein requirement. We want an appropriate level of calcium and phosphorus. We'll talk about calcium supplementation in just a minute. but especially for those large breed dogs, it's really imperative that we're not giving them too much calcium and phosphorus. They also need those essential fatty acids like DHA and antioxidants to help support that growing immune system. So protein builds new tissues. It supports the muscle, skin coat, organ development. We want about 25% of the calories that they're getting from their food to be from protein. It may be a little confusing because I said protein we want to use for building muscle and building lean body mass. You still need to take protein in relation to the rest of the diet. And so we often, as nutritionists, look at this as what percent of the diet, how many calories from that diet are coming from protein. And we talked about the need for a high quality, highly digestible diet. Inadequate protein can lead to a lot of dysfunction. So reduced resistance to toxic or infectious agents, resistance to parasites, wound healing. These puppies are rambunctious. They're going to get some wounds. It's important that they have enough protein in their diet to repair those wounds. And then, of course, skeletal malformation. So if you don't have enough protein in the diet, your bones don't attach to the muscles appropriately, and you can have skeletal malformations. Along those lines, we want, this is a question that I got actually before I even jumped on the lecture, is what do we do about calcium and phosphorus in these dogs? It is imperative that we avoid excessive calcium to large and giant breed dogs. Growing puppies do need more calcium than adult dogs to help build those healthy bones and teeth, but you have to be careful not to give excessive calcium to large and giant breed dogs because it can contribute to skeletal diseases. The reason for that, puppies cannot regulate their calcium absorption like adults. So they will absorb whatever you give them. And pardon me for just one moment, please. All right, my apologies. So puppies will take in whatever calcium and phosphorus you give them. Unlike adults, they have no ability to regulate how much their intestines are absorbing of that calcium and phosphorus. And so we can really unbalance their diet by supplementing calcium on top of an already complete and balanced diet. And so those puppies that get excessive amounts of calcium it can lead to things called like osteochondrosis, curving of the radius, stunted growth actually, which is the complete opposite of what many folks intend by supplementing calcium. We want to stick to a diet that has a calcium phosphorus ratio between 1:1 and really in growth 1.6 to 1.8. What I want you to take away from this is that if you are feeding a complete and balanced diet, you really do not need to supplement any calcium. And in fact, it can cause more harm than good if you are supplementing calcium. So just stick to that complete and balanced diet. DHA, and I know we're running a little short on time, so I do want to touch on this very quickly though. DHA is vital for optimal brain and retinal development. I mentioned that a little bit earlier. It accumulates in the puppy's brain during perinatal development. And by about 6 weeks of age, 70% of that puppy's brain mass is DHA. So obviously extremely important in terms of a nutrient. By 12 weeks of age, they are at 90% of adult brain mass of DHA. And so this is incredibly important in terms of a nutrient. What does that mean for you? And for the eventual owners of this puppy? These pups that were supplemented with DHA actually had higher trainability scores than puppies that did not get DHA. And so they were more able to actually learn the things that you're trying to teach them. So fish oil, an incredibly important nutrient in puppy foods. with that, I just want to quickly summarize what we talked about today, and then we'll take a couple questions. Optimal nutrition is not going to guarantee a perfect outcome. There's a lot of things that go into puppy development, but it definitely, certainly significantly reduces the risk that something is going to go wrong. Many aspects of dog breeding are very difficult to manage, as you all know. Nutrition was one of those things that can be controlled. And so I highly encourage you to feed a complete and balanced diet to your, not only your moms, but to your puppies as well. Anything that we add to that kibble, to that canned food, potentially has the risk of unbalancing that diet. And so if you're planning on adding something like that, please reach out to a board-certified veterinary nutritionist. They can work with you to come up with a plan that's best for your situation. As well as, of course, talk to your veterinarian. They have a lot of great resources as well. Proper nutrition, vital for production of healthy litters. Start feeding mom a growth and gestation diet at that 5th week of pregnancy. And that's when you're also going to start increasing calories for her. Gestating and lactating moms, growing puppies, they have very unique nutritional requirements compared to non-breeding adult dogs. Those puppies, try and get them to nurse to ensure that they get enough of that colostrum, that is antibody-rich colostrum. And of course, I mentioned growth diets. Those are absolutely necessary until that pup is skeletally mature. And with that, I think we have reached the end. So I will turn it back over to take any of your questions that we might have.
Thank you so much, Dr. Naik. That was a very engaging talk. I learned a lot, and we have lots of questions coming in. We will not have time to answer every question. I apologize in advance. I know everyone wants their question answered, but we do have some questions that we got from more than one person, so we'll try to ask some of those. And probably the biggest one, you touched on this, but can we clarify, can you please address calcium supplements for the mother? There's a lot of conflicting advice out there, and we did get a few questions about calcium for moms.
Yeah, absolutely. Let me go back to that one. So the reason that I recommend avoiding calcium supplementation in the mom is because the puppies are getting their calcium from mom, right? And so if you are feeding an excessive amount of calcium to mom, it doesn't necessarily help with improving the amount of milk that she's producing. I think that's often the reason that calcium is supplemented. Unfortunately, it goes right into the milk, and these puppies cannot regulate how much calcium they're taking in. They're just physically incapable of regulating that. And so if we are giving too much calcium, we are very significantly increasing the risk that these puppies are going to grow up with skeletal deformities, that they're going to have actually stunted growth that I mentioned before. And so if you are feeding a complete and balanced diet, don't worry about the calcium supplementation. It's a good question. I think it's a very common misconception. So
yeah, and on a similar note, would you say the same is true of folic acid in the pregnant bitch?
Yes, absolutely. Okay. So any nutrient, really, if you're feeding a complete and balanced diet, you shouldn't need to supplement anything.
Great. We got a few questions on picky eater. So if the mom is maybe picky, doesn't want to eat the kibble, or what can people mix in with a kibble diet if the mom is just not really into the diet she's being fed, especially in that last trimester?
Yeah, and that's a good point, because that's why I recommend just sticking with whatever diet mom likes. Honestly, I would just feed her the same diet regardless of whether you find a good all life stages diet. Not to be an ad, but that Purina Pro Plan 30/20 is an all life stages diet. Just feed it all the time. You don't have to worry about transitioning there. The things that I can recommend adding in, I always say, as long as you are not going above about 10% of their caloric intake from what we would call treats. And a lot of people won't consider things that you mix into the diet a treat, but it absolutely is. There is less chance that you're going to unbalance that diet. So if mom really likes a low sodium chicken broth, that can be a good addition. A lot of dogs, they love things like carrots. Anything that you can kind of mix in there to spice it up a little for them, I think is helpful. Oftentimes I recommend just taking a canned version of that similar formula and mixing it in with the dry food. That's totally acceptable. Makes you not have to worry about unbalancing this diet potentially.
Okay, and since you mentioned the Purina Pro Plan Performance 30/20, we did get a question about, like, if that's the kind of complete nutrition for puppies, how do people navigate the several different kinds of puppy food out there? Is this something they need to be looking at labels carefully, or is it just giving people choices or puppies choices?
Yeah, a lot of it is just giving people choices. There are, in some puppy formulas, there are things like higher levels of omega-3 fatty acids. If that's something that you're looking for your puppy, and you feel like, your veterinarian has recommended that that is something to look for, certainly you can look for a diet that is, the primary protein is salmon. There's a good chance it's gonna be high in omega-3 fatty acids. I think what I tell people is look for a reputable manufacturer, and ask them those questions that I outlined earlier. As long as it is complete and balanced for puppy growth, and if you're breeding golden retrievers, it should be a large breed puppy diet. I'm okay with whatever consumer choice you have, as long as your veterinarian is okay with it as well. They'll be the best arbiters of this puppy needs this particular diet. But a lot of it is consumer choice.
Great. And we have a question from someone with a small breed, 20-pound border terriers. They say that some breeders suggest that small breed puppy food is too rich and promotes too fast growth, and they recommend feeding a large breed puppy kibble with no supplementation. It's also what I am feeding the dam. Do you have any thoughts or feedback on that?
That's an interesting question. It depends on, so actually this ties into the previous question, and I should have mentioned this. The formulas that are on the market vary pretty significantly from one another. And so some diets, if it's marketed as like a large breed diet, oftentimes they are lower in calories because you're feeding this dog a lot of food. You don't want them to grow too quickly. There are, some of the quote unquote premium diets tend to be really high in calories. And so it takes a lot of evaluation of that pet food to know what is right for your pet. Is your pet obese prone or overweight prone? And so if you have a small breed dog that, I don't want to, I'll pick on pugs, they tend to be obese prone. I'm going to look for a lower calorie diet for that particular dam. However, there are some pugs that have fantastic metabolisms, and you can look for a higher calorie food for them. The small breed label versus like I'll use senior diets as an example. There is no AFCO definition of a senior diet. There is none. So pet food manufacturers can say, this is what we think is a good senior diet. And the same goes for kind of a small breed diet. So find a manufacturer you trust and believe in their nutritional philosophy. As long as that diet is complete and balanced and meets that patient's or that dog's nutrition needs, I'm okay with that. Talk to your vet. They're going to be able to say, you need a lower calorie food or you need a higher calorie food.
Thank you. Is there any danger in supplementing DHA for mom or puppy?
So it's not specifically a danger of DHA. It is a potential danger of fish oil, omega-3 fatty acids that we've seen. It's seen more sometimes in cats as well. But if you give an excessive amount, I'm talking like a huge amount of omega-3 fatty acids, you could potentially see blood clotting issues. And so on the human side, surgeons will tell folks to stop taking fish oil supplements 2 weeks before they have surgery for that specific reason. Chances are that the doses that you're using on a label of a supplement, you're going to be okay. But if you are using a premium diet it is important to talk to your vet because that diet may already be really well supplemented with omega-3 fatty acids. And then you're just adding more on top of that. So.
Gotcha. Well, thank you so much. Unfortunately, we are out of time. I feel like we could ask you questions about nutrition all day, but unfortunately we can't. So
No problem.
Thank you so much for your time and your excellent talk.
Thank you. Thank you. I appreciate the opportunity.
Great. And thank you everybody who came today. We will be sharing a recording for everyone who came late or wants to watch it again. And like Dr. Naik said, we will be sure to provide you with access to those resources he mentioned.